Good afternoon. Gina Dubbe here from Greenhouse Wellness with Dr. Mark Matsunaga, who has his own practice in pain management. Today's discussion is going to be on pain management and how cannabis works in that industry. Dr. Matsunaga, thank you for being with us today.
My pleasure.
We so appreciate it. Tell us a little bit about you.
Well, I'm board certified anesthesiology and pain management, and focused on pain management for the second half of my career here. Found it very rewarding trying to find ways to keep people functioning and help manage their pain. And have a practice here in Howard County, next to the hospital and over here at Stanford Boulevard. And we focus on trying to find ways to keep people functioning, keep them active, and not lose function while we're taking care of them.
It's an important part of staying healthy. Tell us a little bit about your practice in general. What are the things you focus on? What do you share with your patients?
Our practice, we try to be much more multidisciplinary. We offer doing injections, we do medication management, we do refer out to physical therapy and aquatherapy, and we try to use as many modalities as we can to keep our patients as functional as possible. We focus a lot on toolboxes and what we can offer in the toolbox. And one of the advantages that Maryland has right now is the new program with medicinal marijuana, and has become a big component of our practice.
Can you talk about cannabis and pain management and how you educate your patients or what they should know?
I think our patients coming to us for the certification of cannabis, we emphasize that this is just another tool that they're utilizing to try to find something that's going to give them some benefit, quality of life. We have certain medicinal indications that we have to certify for, but there are also a lot of other effects that people find benefits from the use of cannabis. And like sleep. Sleep is not one of the medicinal indications, but people I think overwhelmingly have claimed that they found a strain that helps them get a good night's rest. And I think that's very important because that helps us manage their pain better as well. Maybe get less on their sleep meds, and a lot of strains helping with pain and get off their opioids. So huge benefit, I think, for people who are willing to undergo the use of medicinal marijuana.
The one thing we need to remember is you have to go to a certifying physician before you go to your dispensary. And Dr. Matsunaga is one of those certifying physicians. When you come to the dispensary, we simply dispense, so we have to know that you've been referred to us from a physician. Now, is there a message that you would send to patients about cannabis and opioids, or cannabis and opioid reduction?
I think that some practices, some clinicians who are prescribing opioids are requiring their patients to minimize or reduce the opioid doses that they're taking. Here at the Comprehensive Pain Center, we use it as another tool. So if it's helping, wonderful. We can try to wean down off our opioids, muscle relaxants, anti-nausea medications for whatever medication usage that we're using for the medicinal marijuana. And I don't think that there's a mandatory requirement that we have to say that if you're using medicinal marijuana, you have to reduce your opioids. But I think most of the clinical evidence has shown that people who find the correct medicinal strain are able to reduce their opioid consumption by about 30% or more.
That's impressive.
It's very impressive.
Have you had people come off of opioids using?
A few people have come completely off. A few people have had no changes, and I don't think anyone has increased their doses because of the starting of medicinal marijuana.
That's great. Now, if you had to recommend a toolbox with cannabis, what would you recommend?
Fortunately, people at the dispensaries are very well educated on the specific strains that you're getting at your dispensaries. I know that Greenhouse Wellness has a very good reputation here in Howard County, and I think that the educating the patients is our priority here, which is your priority over there as well. And I think that's very important for our patients to understand what you're doing, because federally this is still an illegal substance. Federally it's not considered even a Schedule 2 or 3 drug, it's a Schedule 1 drug. So they still don't see from the federal standpoint, they still don't see the value of what Maryland has seen with medicinal marijuana use.
We believe strongly at Greenhouse that this is an adjunct therapy. We believe strongly that we need to educate our patients, and we're staffed with medical professionals, nurses, and Dr. Apgar at the dispensary so that we make sure that we're dispensing the proper type, the proper use, and the proper way to medicate with cannabis. We, I think, jointly agree you start slow, you start low, and you build up. This isn't a one-stop, one kind of thing fits all.
Yeah, unfortunately, there's a lot of experimenting with the different products to find the results that you're looking for. And fortunately, there are a lot of choices, there are a lot of options. And so getting in tune with a dispensary who can offer that kind of education, I think, is very important. And like you said, start low, go slow, and be patient.
When you think about pain management and your needs, Dr. Matsunaga is an excellent option for you here in Howard County. We appreciate your time today. If you have any questions, feel free to respond to us, and we will get back to you on the Greenhouse channel. Thanks for tuning in.